Today I'm presenting the first national perioperative guideline designed to standardize care and prevent avoidable harm for people with Parkinson's throughout the surgical pathway. For these patients, perioperative care must be planned around time-critical medication. Delayed or missed dopaminergic therapy can worsen symptoms, impair swallowing, increase aspiration risk, and delay recovery. In severe cases, it can trigger Parkinsonism hyperpyrexia syndrome, a life-threatening emergency. Parkinson's is the fastest rising neurodegenerative disease worldwide. It affects more than 1% of people aged 65 and over, and global cases are projected to rise by 112%, reaching 25.2 million by 2050. People with Parkinson's are hospitalized around 1 times more often than age-matched peers and have higher rates of perioperative complications, critical care admission, and mortality. The key safety issue is medication timing. Parkinson's medication is time critical, and on time means within 30 minutes of the patient's usual prescribed time. Despite this, over half of people with Parkinson's don't receive their medication on time every time in hospital, causing preventable harm, longer recovery, and increased healthcare costs. Our aim was to develop the first national perioperative guideline for people with Parkinson's, a practical, whole pathway approach to reduce preventable harm across elective and emergency surgery. This is a multidisciplinary guideline developed through CPOC-structured methodology with input from 37 healthcare professionals across 14 disciplines and patient representatives from Parkinson's UK. Patient involvement was integral. Structured interviews were conducted before drafting began, helping define the scope, and patients continued to provide comments throughout guideline development. We used a stepwise methodology: evidence review, stakeholder input, modified Delphi rounds, followed by face-to-face consensus meetings for unresolved statements. After external consultation, the guideline underwent CPOC executive sign-off and CPOC board approval. Endorsement has been sought from 23 stakeholder organizations. The final output was designed for implementation: 8 standards, role-specific recommendations across the perioperative pathway, 13 appendices, and 11 infographics. The result is the whole pathway perioperative guideline. The core safety messages are clear. Give Parkinson's medications within 30 minutes. Plan an alternative route if nil by mouth extends beyond one scheduled dose or more than 4 hours, and assess swallowing and medication swallowing safety using a Parkinson-specific approach. The guideline will be published by CPOC and disseminated in collaboration with stakeholder organizations. The success of this guideline will be measured not by publication, but by whether every person with Parkinson's gets the right medication, by the right route, at the right time throughout the surgical pathway.